Okay, this next section is home working has implications for staff, teams, service users, and organisations. Here's what needs to be considered. We were interested in staff members' experiences of delivering drug and alcohol services remotely during the pandemic. And in discussing this, staff often talked about their experiences of working from home. Working from home was one of the big changes during the pandemic for many staff members. Home working by staff delivering drug and alcohol services has various implications, and our findings outlined a number of different things that need to be considered. The first consideration we'll highlight is this one. The option for some staff to routinely work from home when conducting administrative tasks may have few negative impacts for service users, yet offer benefits such as greater work flexibility and increased efficiency and productivity for staff. So, staff stated that sometimes working from home was more efficient and productive. It allowed them to save travel time, to work uninterrupted, to hold more meetings, and thereby complete more work than they might be able to do if they travelled into the office. They tended to highlight the benefits of having the option and the flexibility to work from home sometimes, especially when doing administrative tasks that didn't involve face-to-face meetings with service users. Of course, working from home wasn't suitable to all staff at all times, and there were certain types of work where staff needed to be on site. But in other cases, such as admin work, there seem to be various potential benefits of allowing a home working option for staff where appropriate, and relatively few negative impacts for the service or the service users. The next consideration we've already touched on a little. It's that whether or not home working is feasible depends on the type of service/support being delivered and the staff member's personal circumstances. For example, whether or not they have private space at home to work or private space to have conversations with service users. So, home working may not be suited to all, but it is important that staff are treated equitably and that rules around home working are clear and well communicated. This can reduce the risk of staff feeling that others are being treated more favourably. Staff spoke a lot about working at home during the pandemic and the challenges that this brought. Obviously, as well as home working, staff also had the challenges of the pandemic and lockdown to deal with, but it was clear that there were difficulties for some staff related to balancing work and family life and separating home and work. For example, staff sometimes found themselves working outside normal working hours when they were working at home. Since the pandemic, some staff have continued to work from home at times, and our analysis suggests that employers can help staff get the right balance by having clear expectations, guidance, and policies around home working. Our analysis showed that staff valued being trusted to work at home during the pandemic, trusted that they can be responsible for doing their jobs even when not working in the office. Allowing home working may be one of the ways that employers can help foster a relationship of mutual trust between them and their employees. Another important consideration is that many employers now offer flexibility in terms of home working opportunities. So to attract and retain staff, it may be important for drug and alcohol services to also offer this flexibility, where it fits with the effective delivery of support. A key finding from our analysis was that being office-based is beneficial for team working, for information sharing, for signposting, for team cohesion, and for peer support. Delivering drug and alcohol services often involves input from multiple teams and staff members. And being office-based helps with the development of those relationships that are necessary, the development of those links and that support. Therefore, opportunities for office-based working should be maintained, even where home working is allowed. It's about allowing flexibility in how people work, to best suit the needs of the service and the service users. Lastly, staff highlighted the high demand for space within buildings, and allowing home working by some staff could help organisations to manage these types of demands.